moments, I just want to first off welcome everyone again to the Rural Health Equity Chat. Thank you for joining and taking the time today. So I'm just going to give a bit of an introduction into today's session. So my name's Veronica, and I'm a rural GP and coordinator of the Rural Health Equity Group on the Health Equity Network. And I'm also the founder of Rural Health Compass, which is a social enterprise looking at ways to address rural health inequity through community-led action and policy engagement. The purpose of the Rural Health Equity Chat is to bring people together, raise awareness on rural health equity challenges, and create a space for participants to discuss their work, experiences, learn, share, and collaborate across sectors. So the way that the sessions are planned is we have a bit of a welcome, which is this part. Then we have a featured speaker. We go into a bit of a discussion, and then we close our session at around an hour. So our speaker today is William Nicholson. He has lived and worked in urban settings all his life, mainly in Hong Kong and London, but now lives in a rural farming community in Northern Ireland. Professionally, he's worked in the area of integrated care for over 15 years, and he's passionate about systems and culture change. So this has led him to becoming the co-convener of A Better Way, which is a UK-wide cross-sectoral network of over 1,500 members who are passionate about building stronger communities, improving services, and creating a more just and equitable society by applying a set of co-created Better Way principles and behaviors. So this is what we'll be talking about in a little while. And after that, we will have the opportunity for you to ask questions and share any of your experiences. So Will, I'm going to stop sharing my screen and hand it over to you.
Great. Thank you so much, Veronica, for bringing me here today and for giving me this opportunity to talk to everyone. I've got a few slides which I will present. So hopefully I'll just bring this up in a second. But yeah, thanks for that introduction as well. I think it's just to be really good. I moved to a rural community three years ago, having lived my entire life in so not just urban settings, but in really big cities, so Hong Kong, London, Edinburgh. So I've had quite a diverse experience. I've done a lot of work in the area of integrated care and health, and really in that interface between the health system and an amazing sort of plethora of people, assets in all parts of the community that actually really want to combine and work, to sort of support health and well-being in its broadest sense. And I've done that like in urban settings all my life, but now having this opportunity myself to living in a rural area and experiencing just how different, how similar an awful lot is, but also how different some of the contextual challenges are for rural communities. So, but one thing that I want to talk to everyone here today about, which is really for me, the times that I've been happiest, the projects I've most enjoyed working in, the places, the spaces, the communities I've most enjoyed, I say being in or meeting, have had a very common set of principles and behaviors behind them. And when I came across the Better Way network, this was a network set up 8 years ago, I suddenly discovered a set of principles and behaviors that actually the times I've been happiest and the people I've most enjoyed working in, the things I've most enjoyed the most have these sets of principles and values behind them in whatever context, whatever sector, at individual level or at collective level. So that's really what I want to talk to everyone today about, is these sets of principles and behaviors. A Better Way came about, if you look at this sort of left-hand box here, a group of people about 8 years ago, Steve Weiler and Caroline Slocott, the founders of the network, brought people together because they're thinking, gosh, there's so many challenges out there. There's so much great stuff happening, but we can't keep going on as we are. There really is quite a lot of fragmentation, a lot of disjointedness in the way things are done. There's a lot of challenges that we experience in society So what is it that we could do that changes the way we work, that pulls together a set of principles and behaviors that that could support us to do things differently in the starting point of the context that we can't keep doing what we're doing. And a better way over the last 8 years grew from 2 people having conversation to 4 to 8, and now sits at around 1,500 people who are all across the UK, from grassroots level through to national leaders of not just charities and public sector and the NHS and so forth, who are really, really passionate about a bigger we, the opportunity to do things together that we can't do on our own in order to build stronger communities, to create a more just and equitable society. The network, I think, really adds benefit to the people who come to it through, a bit like today. You get inspired, you learn about things that you didn't realize existed, or that reinforce the things that you know that's working, and now you know why. It gives you a chance to step out from the day-to-day, chance to meet people you wouldn't normally meet. And that last bullet point here, the opportunity to contribute to something greater. That's something that really unites us. And the network was founded on a whole set of conversations. It was co-created over the first 4 years of the network. What would a better way look like? What would be its principles? And these 8 principles, which are on the left-hand side here, they can be found on our website. And behind each one of these, and I'll share the links for people afterwards, but behind each one of these is a whole set of depth of conversations and case studies that kind of support why these were selected. And I'm guessing that most people here won't disagree with these. There might be differences in the way that they're worded, but what I found is that when I meet with people, especially in these kind of environments, and people here are talking about health equity in rural settings or health equity in general, is that what we're describing is what would a better way look like. And it's like prevention better than cure, building on strengths, focusing on relationships. How do we support mass participation rather than 1 or 2 people doing everything for everyone else? This one in particular, local is better than national. There's lots of really, and this is not about a competition between one or the other, but it's about saying that actually in the round, most of the time, if we can find ways to get local action and plug it into national frameworks, it is a better way of doing things. And I think that particularly is relevant in the rural setting, where there's such differences in each of the local rural areas, and where you make mass general sort of strategy or policy, it's so hard to implement that as a sort of one size fits all. You've got to really, really tailor it to the community in which you're living in. My personal favorite, I won't go through all of these, but my personal favorite one is this bottom right. Changing ourselves is better than demanding change of others. And I think a lot of the time we live in a world where it's like, right, we need to do things differently, and you end up telling people that they've got to do it in a different way. So I'm here not sort of coming to tell you that this is what you must do, but like I said, there's so many people who are just living and embracing this way of being. I just love finding ways to combine with people who are already doing this, finding ways for myself to try and embed these ways of working into everything that I do. And what I find is that the more we do this, people start to gravitate to those positive spaces. On the right-hand side here is, we describe it as the Better Way beach ball. It's like these are sort of the ways of working, or a behavior change model, you could call it that. But I use these all the time, and I've not just in in any context really. The opportunity, to build relationships, first, to before diving in and thinking this is what I want to get out of something, the chance to get to know people, and this is the foundation for me. What I really love about this value on the right hand side here, sharing and crucially building power. I think a lot of people fear power sharing or distributing of power. It kind of comes then with the negative term that in order to share power, you have to give something up. And that's not what we're talking about here. This is about, I think, sharing power in order to build more together, to create synergy. And I think that's something I find hugely encouraging, is that when you do share power, you can achieve so much more because you can build power in others rather than viewing it as a sense of something that you're giving up. Listening, creating the spaces in all of our work to listen, not just in the context of health, to the community on its own, but listening to each other, the people who are working in the NHS or in teams who are supporting people, finding ways for organizations to listen to each other. And there's so much of that we need to embrace into our ways of working in order to join forces. Because, and like it says here, because most problems are too complex to solve alone. And it's that chance to do something together that we can't do by ourselves. And that's certainly what excites me. And that's why I'm here today, because I love sharing these with people and finding ways in which we can combine our strengths. So those principles, they were hundreds of conversations over a 4-year period. The great thing is I didn't come up with these. I found the Better Way Network, and I just went, you know what, this is absolutely fantastic, because someone has very nicely described the world in which I would love to be in and what I aspire to create in the projects and the people that I work with. What this also does is it helped bring together 1,500 people. So I suddenly have now got this incredible network of people who have a very, very similar mindset and a similar approach to life. And then when I met Veronica and I came across the health equity chat, the rural health equity chat, I was like, this is absolutely fantastic, because I'm again meeting people who are very, very like-minded, and that makes life a lot easier when it comes to collaborating in all different settings. What I find is I've just got a few slides just showing a few visuals that kind of bring to life the principles and the values, particularly when we're talking about health systems. I found this really, really helpful. This belief system one, and this was shared with me by one of the members of A Better Way. This belief system one is, I think we can probably all, what's the word, resonate with this, which is the kind of dominant system in which we're operating in, very sort of managementy, very controlled, terms that even the language, of strong leadership and policies and targets and what we're, I think, aspiring to, and what I would love to see as an approach to how we work in rural communities would be how we can be very, very imaginative and innovative, how we can, work creatively, very socially, and having these sort of innovative social teams, small teams that can go out and experiment and be more free to create. Just a couple of other slides just to highlight some of the principles and actions, values in action. But I really love this because so much of the time we only hear from one perspective, or we're hearing from one organization. And really, to be successful, I think, in collaborating and working together, we've got to look at that whole picture. Whether that's the whole picture of the whole person that we're seeing, in a health setting, and it could be the whole person and their family. But I think an awful lot in rural settings, and what I've got, what I've been learning, living now in Northern Ireland here, is how can I really, really understand all the different parts of the community, how it all fits together. And it's absolutely fabulous, again, having meetings like this where you can meet people who come from different backgrounds, who have different perspectives, and find ways in which to look at the whole picture. I love this slide. Again, I think for people here who are interested in rural community, the connection to nature. So much of what we're talking about here just replicates and is in nature. All trees and forests are connected through these mycelial networks. So beneath the surface, particularly through the mushrooms and fungal networks, is that there's an awful lot of connectivity that sits underneath the surface that enables what looks on the surface as disconnected or individual plants or individual trees have a connectivity behind it. So something that I think through that model of relationship building, joining forces, listening, sharing and building power is the creation of these networks. And I think I love meeting people who share this same sort of philosophy, and you meet people and you realize that between us we have huge amounts of connections. And if you can join forces and find other connectors that are out there, these networks can really bring about really quite significant collaborative change. How we can join up what on the surface looks like so many disparate things. The last thing I'm just going to finish on is a couple of slides just talking about collaborative approaches and how we've been approaching this through a better way, but also how I go about my work. I often spend an awful lot of time coming to meetings like this, looking for people who are thinking different, who are looking at ways in which to work collaboratively and work together. If you can cluster those pioneers, the outliers, the mavericks, people who are just thinking, you know what, a very different way of doing it, and create settings like this health equity chat where you can come together and start to build networks of people who are thinking differently, you can start to build a new system. Crucially, it's not about taking people from the existing system and forcing them into this journey of change, but it's helping those that are currently doing hugely important jobs, particularly in the health system, to stabilize that system, to do as best they can to keep things running as they are, and to transition that system into a new system once we get there. But what I found is that if we don't invest in this dual process, this both keeping the existing system going, learning to hospice and compost the things that haven't quite worked or things that have worked well, but we need to reimagine them in the new system. But finding ways to bring people together to think differently. If we do not do both, we will continue to end up slowly running the current system into the ground. And I think that's where we are right now with a lot of the NHS stuff. It's so challenging, and it's becoming more and more difficult to work in the health system because not just the scale of it, but the scale of the people in waiting list, but the challenges on staff, and the system is at a creaking point. But I think part of what I love the discussion to be today is like, if we can find ways to do things differently, pool resources, find people in and out of the system, and create a new way of doing things, that was going to give us hope. And these statistics, these percentages, are something that I found really interesting. This is the same in all walks of life, whether it's from virus spread, social media spread, diffusion of innovation and technology, how you do community building. You will often only get around 2.5 to 2 to 3% of people who are the people who will kickstart something or get things going, be the catalyst, will come up with the idea. And absolutely crucially, it's then finding what's called as either the early adopter group, finding your coalition of the willing champions. In the world of community development, is finding your community builders and connecting into your community connectors. The key to this, and it's really challenging, particularly when we work in health systems, is that we feel that we need to bring everyone into every discussion, that we want that in order to be equitable and accessible, or to create inclusion, we have to invite everyone to every meeting. So one of the challenges is about how we can bring the right people into the right meetings. And actually, if you can empower this group of early adopters, they are the ones that can communicate and bring on board the early and late majority of people. If you think about it in terms of technology and using computers and using iPads, for example, or smartphones, what they all did very successfully was not roll out the smartphones to the entire population. It actually went through a process where everyone was, it gave it to the most innovative people to take on the new technology. they eventually started to spread it to the early adopters. And if anyone is like me, I was in this probably late majority. I was quite curious about using a new thing, but I was very, very happy using my BlackBerry for a very long time, until all my friends basically said, you are missing out on something. You now need to get involved. So this process of how you put those better way principles and behaviors into action, it follows this, for me anyway, this approach that starts with finding and identifying the people who are most ready for this and using them as champions of that cause. So just a couple of just something to finish with here. I think a large part of what we're talking about here, in order to put these different creative practices into action, is about a culture change. And we hear that a lot. We need to do system culture change. So I love this phrase. This came about from some work that or connections I've had with the International Futures Forum, and they have really, really interesting kind of system change methodology. And the founder of that network, Graham Hancock, he shared with me this wonderful phrase of small acts of creative transgression. So as we're going about trying to affect change, bring about collaboration, it's not about imposing this on people. It's something we said earlier about, but how you can make small changes. Be very creative in how you make those changes, how you can nudge, how you can prompt. If you do something really significant, really big, it often results in a lot of resistance, or it feels like a revolution. And particularly if you're trying to do something in the health system, if you try and impose it on lots of people, it will be pushed back quite considerably. But really, really crucially is that you are introducing these different types of ways of working in the soil of the old system, so in the health system, but not in support of the way we're doing things now. So if you come back to these different sets of principles and things, it's really, really getting clear, right, we are going to do it differently. If we are going to do work in this way, how can we introduce this and make sure that we stay with it? We've got to keep transgressing, because if we want to shift culture, we want to make change, we can't just accept what we're doing now is working. We have to challenge it. We have to do it in a very creative way. And we have to be disruptive in the way that we do it. So hopefully that's helpful. That was the first bit I wanted to tell everyone about, was a few slides just about different ways in which we can, different sets of principles and values in which we can use in order to, I guess, facilitate more collaborative working. And this can be applied in any setting, but I think particularly for rural settings, this is hugely important in the sense of how we can bring people together across quite geographically dispersed communities. So I want to talk just lastly, just applying these principles to now. I mentioned earlier at the beginning that I used to live a lot all my life in urban settings, and now I found myself living and working in Northern Trust region of in Northern Ireland, and just to it's so geographically vast, and these are all just brand new to me. When I came in here, I was so used to having everything on my doorstep within a 10-minute, the 15-minute city that so many people talk about. And it's like, wow, this trust area spans 1,700 miles. 40% of the population, over 40%, live in rural settings. But what I've really loved about finding out about the Northern Trust, and I've got a couple of colleagues here from the Northern Trust, it would be great to get their perspectives on it, is that they have really, really started to apply a lot of those principles and behaviors that I was talking about, and thinking about how they can do health differently, acknowledging the rural context in which they're operating in, the development of a rural matters framework and a rural health toolkit, the creation of rural staff fora. I thought that was absolutely brilliant to have a staff forum that brings together so many staff members live rurally as well as are working in rural contexts. So actually bringing people together who have the personal understanding of what it's like to live in a rural setting and connections into the communities in which they live, and finding ways to combine that with their role in the NHS and their actual sort of job, I think that's been really, really great for me to see that happening in our local trust. And I think for me, really brings alive some of those better way principles, in terms of creating listening spaces, opportunities for those staff members to build relationships with each other. The rural conference that was held in April last year, again, fantastic ways in which to share and build power, to introduce programs such as the Farm Families Health Check program, which makes it, taking traditional health, checks and putting them into the context and the settings in which they're going to be most likely to be uptaken in local communities in which we live. So for me, I just wanted to highlight just a few of the ways in which the local trust in which I'm living in which my family use, how they have started to adapt their ways of working using those principles and put that into practice. One thing that we're all working on, I'm sure this is for all of you on here as well, move towards population health. And this is the Northern Trust's kind of statement on it, which, so I sit on the Northern Trust Population Health Committee. And it's everything we've just been talking about. It's about the whole picture. It's good for everyone. It's not just good for, for patients, it's good for their families, it's good for the staff, good for business. It's an opportunity to work together as a community in order to live well. And I think what I want to talk about in terms of the Population Health Committee and the Northern Trust is that we've had this opportunity to start to put some of those better way principles and behaviours into even more action in the local community. So this is something that in the community in which I live, in Draperstown, it's a very small rural community, so probably around 5,000 people live in and around that, sort of in the town and the neighbouring villages around Draperstown. And we started to go through that process of building relationships with local organisations, local groups, the local community forum. STEPS is the mental health charity that I do a bit of work for. We're bringing it together with a local business collaborative, the Workspace Group, combining it with the Northern Trust Population Health Committee and the council in the area. We are just looking at ways in which we can share and and build power amongst ourselves, find ways to join forces, because at the moment, particular challenges, as everyone will be experiencing here, around access and transport and having services that are open to all parts of the community. It's all very well saying that we want to introduce this, but if we don't create these partnerships and these opportunities for collaboration between us, it's actually really, really hard to do things. There's no way we can do it unless we solve it. It's a bit of a wicked problem. So what we have through this opportunity, we've created something called Thrive Experience, which just gives us an opportunity to bring everyone together. And in a few weeks' time, we're going to be going to our local school to find ways in which we can combine, like the Northern Trust's offer of support for people, for our children and our young people, but going into the setting in which they're based, but combining it with ways in which it's going to make it most relevant for them. So through their classes or through using the local groups like STEPS to deliver some of these programs. But none of that would be possible if we didn't have that foundation of relationships and joining forces that we're going through. So I just wanted to highlight that I'm taking a lot of those better way principles and behaviors and putting them into practice in the local community in which I'm now living. Great, that's all I wanted to share. Happy to keep these or send these slides around to people, but really, yeah, I think I'd be really interested to get people's thoughts on these sets of principles and behaviors, how they might apply in your settings, how you see them, do they resonate with you? Yeah, really open up the discussion.
Thank you very much, Will, and I will hand it over to all of you for any questions or initial comments, so please go ahead.